Looks good. Thank you. Thanks very much. So we're going to end up, after traveling through the country, with Ontario, and I'm going to talk about breaking down barriers in Ontario, and what we're doing for that. So I'm with what used to be called the Ministry of Labor. It's now called the Ministry of Labor, Training and Skills Development, and has a new acronym, MLTSD, I think. Yep. So that's close. The goal of this Healthy Worker, Healthy Workplace project is it's to integrate Ministry of Labor enforcement activities with health and safety system prevention activities through a transparent process that takes into consideration also occupational disease research. And I'll be talking about our Safe at Work Ontario program that provides for a flexible, risk-based approach to enforcement, together with a program of compliance promotion and compliance assistance. And it really ends up filling what this says here. I'm pointing to the sign, it says prevention through intervention, by coordinating all those appropriate groups and breaking down some of the barriers. So the Safe at Work Ontario program is a Ministry of Labor strategy to raise awareness of and increase compliance with the Occupational Health and Safety Act. And it's designed to be responsive to stakeholder concerns, current events, and strategic priorities. So it provides for a risk-based approach to compliance assistance, and the strategy is built on what we've learned throughout the past experiences and through consultation with stakeholders and system partners. So that's a very major component of it. Is the consultation process, which I'll talk about, and working with our system partners. When I'm talking about system partners, I'm talking about with OHCOW, I'm talking about working with the health and safety associations and partnering closely with them and with the Workers' Health and Safety Center. And the outcome, of course, is for a safe, healthy, and fair Ontario. So these are the cornerstones of the Safe at Work Ontario program. So you have risk-based inspections, transparent inspections through our sector plans. I'll talk a little bit more about our sector plans, but if you want to know what our Ministry of Labor inspectors are looking for when they go out and do an inspection, especially our proactive inspections, it's all detailed for you in our sector plans posted on our website. It's a very compliance-focused approach with system partnerships, so compliance promotion and system partnership with my colleagues in the prevention division at the Ministry of Labor and with the health and safety associations and of course with OHCOW. There's a strong focus on the internal responsibility system, so all the workplace parties have a responsibility for health and safety in the workplace. Of course, the employers control the workplace, they have the most responsibility, but everybody has responsibilities and workers have the right to participate in workplace health and safety. The Safe at Work Ontario process is a continuous improvement process. So we have consultations every year. We've had consultations for the last 11 years or so. We're on to our 12th set of consultations. We had 2 last year, 1 this year. We just finished up this year's consultations in October. And it's actualized through risk-based inspection process. So as mentioned, we have consultations, public consultations, every year to reach out to you and get your input and to gather information on our strategic planning process. So over these last 11 years, we've had 12 sessions. We had 2 last year, 1 this year. This year, we had over 160 people attend the in-person sessions. We also had web sessions too, so people could participate if they weren't in Toronto or Sudbury. We had 7 in-person sessions this year and 3 web sessions. And starting last year, we posted in advance a consultation paper with links and resources for stakeholder review. And we also had a email address for people to put in submissions if they wanted. And we finished each consultation with a hazard survey. So we had links, we provided a link to hazard survey so stakeholders could provide their hazards of concern in their workplace that they would like the health and safety system to focus on in the coming years. And we gathered all this information, roll it up, and we use it over the next few years. So I mentioned our compliance plans, our sector compliance plans. We develop annual sector-specific compliance plans that focus on hazards in those workplaces. So we have sector plans for the industrial health and safety, for the industrial sector, mining sector, construction sector, healthcare sector, and we have plans also for our specialized and professional services, where we get input from our, Kevin asked the question, from our hygienists and our ergonomists and our professional engineers also into hazards. So they describe the sector plans. What do our inspectors look for when they go into workplaces? So this is a transparent process, so you know what they're looking for. The sector plans also have references to the Occupational Health and Safety Act and regulations, and also resources for you to help you improve your workplace, make it safe before an inspector comes in. If the inspector comes in and finds problems, then the inspector does what the inspector does in terms of enforcement. But we work closely with the health and safety associations and with OHCOW to ensure that there's resources available for you so that you know what to do to make your workplaces better. And these sector plans are posted on the ontario.ca website. You can see that there. We also have initiatives, which is I'm going to be focusing on today, which combine education, outreach, and awareness with inspection blitzes. So we have provincial initiatives which identify types of workplaces for inspections based on hazards inherent to those specific workplaces. We don't announce which specific companies we go into or workplaces or employers we go into, but we provide general information on what our focus is going to be. So these are planned, these initiatives are planned and implemented in collaboration with Ontario's health and safety system partners. So this has been an innovation that's been in development over the last several years, and it's really come to fruition in the last 3 years. This year right now, 2019-2020, with our initiatives, it's completely integrated into the planning of the Ministry of Labor's proactive enforcement activities. As you see through our sector plans and initiatives, we've integrated with our health and safety system partners. We've integrated with including OHCOW, and we also utilize information from other partners, whether it be OCRC, Institute for Work and Health, CREOT, CREA-MSK. We use all that information also to help us. As I mentioned, we have education, outreach, and an awareness phase first before our enforcement activities start. That's led by our system partners in collaboration with the Ministry of Labor. So that we'll do joint webinars with our health and safety system partners. We'll ensure that there's information prepared for you so that you can improve your workplaces or help if a Ministry of Labor inspector goes in to get that information that you need to make your workplaces safer. Again, so that's going to raise awareness and provide you with the resources to help you in your workplaces. And you'll know ahead of time if an inspector comes in what they're going to be focusing on. So the education, outreach, and awareness, after that, then the inspection blitz phase starts. That's usually about a month later for the major provincial initiatives. And that's where the inspectors will check for, Ministry of Labor inspectors will check for compliance with the Occupational Health and Safety Act, and will provide compliance assistance as needed, or also refer the workplaces to our health and safety system partners for compliance assistance, compliance promotion. In 2019-2020, this year, so we've had 2 all-sector provincial initiatives. I'll talk a bit more about that in a moment. 8 sector-specific initiatives of shorter duration, and a cross-sector initiative. So the initiative focuses are determined using a risk-based approach that takes into account health and safety risks based on injury, illness, and fatality data, say from WSIB and the Ministry's operational database, but we go beyond that. As I mentioned, we use health and safety research, whether it's from OCRC, Institute for Work and Health, from the work that OHCOW is doing. We have our stakeholder feedback from our Safe at Work Ontario consultations and other specific meetings with stakeholders. And then from our system partners, we meet regularly with health and safety associations, with OHCOW and Workers' Health and Safety Center, and WSIB to get feedback from them on a regular basis. And then, of course, our internal consultation process within the Ministry of Labor, with Ministry of Labor Operations Division, where I am, my colleagues in the Prevention Division and Policy Division. So this is an overview of our calendar for 2019-2020 in terms of what we're doing. Our two major initiatives were a traumatic injury initiative earlier this year on slips, trips, and falls. That was 4 months long, and the other one is the one going on right now, Healthy Worker, Healthy Workplace initiative that's focusing on MSD prevention and respiratory hazards. And you see in our construction program, we were looking at suspended access equipment and personal protective equipment, healthcare, workplace violence in group homes. Industrial program focused on new and young workers during the summer when they're out, new workers and summer students are out in the workplace. Industrial program on machine guarding and mining program on ground control and emergency preparedness. Just by the way, we timed the Healthy Worker, Workplace initiative, we timed that to coincide with October, right, to put all that together. So a little bit more detail about our second all-sector initiative this year on healthy workers and healthy workplaces, focusing on musculoskeletal disorders and respiratory hazards. So we know MSD is a huge problem in the construction sector for either unsafe lifting, lowering, pushing, pulling, etc., carrying materials. Healthcare sector, similarly, either client activities, client handling, transferring, repositioning. There's also issues about respiratory hazards in healthcare. Just step back a bit from the previous bullet. In construction also, of course, we heard about silica and asbestos hazards. Industrial hazards, we're looking at manual material handling and respiratory hazards such as diesel particulates. In the mining sector, again, MSD is focusing on there and respiratory hazards for underground and surface mining. Some of our system partners, of course, they're having a bit of a broader focus, and some of the health and safety associations and OHCOW, of course, have also been expanding on mental health areas that the Ministry of Labour doesn't really get into, but focusing on mental health, which is, of course, an extremely important area of workplace health. As I mentioned, the first phase starts off with education, outreach, and awareness, and this particular initiative is started in September and went on for 4 months, and it consisted of compliance support, compliance promotion, promoting awareness, and working with our health and safety partners to get the message out and to ensure that the tools are available and ready ahead of time to help you in your workplaces. So that's followed up by an inspection blitz, so that started in October, so it's going on now, and that's a focused inspection campaign. Again, for you hygienists in the crowd, that was greatly contributed to by our colleagues in the Ministry of Labour that are involved with occupational hygiene. Mark Cousineau, our provincial hygienist, contributed greatly to that, along with our colleagues in the health and safety associations. So what was the rationale? So from our Safe at Work Ontario consultations and our system partners, MSDs and respiratory exposures were identified as priority initiative issues. So let's look a little bit on the stats on MSDs that you can see here. So there was over 19,000 claims for MSDs in 2017 at the Ontario WSIB, and over 462,000 days lost in 2017 alone. Bodily reaction and exertion was the event that led to the most allowed lost time claims in 2017, approximately 38%. So that's a good reason to focus on that. Also, there was a new MSD guideline published in October 2018. Again, it's a partnership between the Ministry of Labour and our health and safety system partners. So what better time to have an MSD initiative than after publication of that guideline, when hopefully everybody should know what they can do to make workplaces safer for workers. A little bit of stats on respiratory exposures and associated illnesses. Again, to explain why we have that focus this particular year. So between 2008 and 2017, long latency illnesses accounted for the largest portion of allowed WSIB benefit costs. 70% of long latency illness claims over the past 10 years come from lung cancer, pleuroplaques, mesothelioma, asbestosis, and chronic obstructive pulmonary disease, which are also associated with respiratory exposures, and of course are all preventable. So my colleagues at Cancer Care Ontario and OCRC, hello Dr. Demers, great help to me, thank you very much. So they estimate that exposure to asbestos, diesel engine exhaust, and crystalline silica and welding fumes caused approximately 1,300 cancer cases each year in 2017. And I'm just going to go through a bit more of those details in a moment about that. So again, in this particular initiative, so why are we focusing on it? What's the rationale in addition to the stakeholder input and some of the data that I went through? So respiratory exposures, we picked the major exposures based on a report from Cancer Care Ontario that was published in 2017, a very good policy report, Burden of Occupational Cancer in Ontario. And in addition to recognizing and evaluating the burden, there were very positive policy recommendations there, which we were able to utilize. And so that report's posted online. That's the Ontario report, and OCRC just published a pan-Canadian report also, which is extremely useful and very, very good reading. I'm just going to go through some of the information that we derived from that report to help us design our focus for this particular initiative. So asbestos exposure in Ontario. So we know that fewer than 55,000 workers are exposed, but workplace asbestos exposure is estimated to cause 630 lung cancers, 140 mesotheliomas, and 15 laryngeal cancers annually. Asbestos is still a problem. So you can see the breakdown of industries there. And so that also helped us focus what we're doing, which industries we're going to look at for this particular initiative. Same thing with diesel engine exhaust exposure. So transportation and warehousing, a lot of people exposed, mostly medium exposures. Mining, smaller number of people exposed, but very high levels of diesel engine exhaust exposure. So this helped us with some of our focus and what we wanted to do. So we know that about 301,000 workers are exposed every year and accounts for 170 lung cancer cases and 45 bladder cancer cases. Right, so this is something we want to prevent and avoid. Lung cancer attributed to occupational diesel engine exhaust exposure are primarily from workers in mining and transportation and warehousing sectors. And those are two of the major sectors we're focusing on in this particular initiative and working closely with our partners there. And crystalline silica exposure in Ontario. So again, you see major exposures to a large number of workers in the construction sector and in manufacturing. And every year it's estimated 142,000 Ontario workers are exposed to crystalline silica, which causes annually about 200 lung cancers. And most of the exposures in construction and manufacturing. So that's again, that information is from OCRC, and that's how we utilize it in our strategy this year, an enforcement strategy, and working with our partners there. So that's, so that's the end of my presentation. Val, you asked me to make an announcement about something else? Okay.
Yeah, it was about the rate changes for January.
Right.
I don't know if you wanted to mention them at all.
Oh, I'll mention it. I won't speak to them, though. So the codes for medical surveillance for the designated substance regulations are being updated. The ones that are in effect now came in effect in like 1982, 1983, 1984, and as you can guess, they're slightly out of date and may not be sufficiently protective. There's new codes for medical surveillance coming into effect January the 1st, 2020, right? If you're interested in hearing more about it, two of my colleagues will be speaking tomorrow at 8 a.m. at St. Michael's Hospital Rounds. Dr. Nick Rajaram and Mark Cousineau. If you can't make it there, you can see it online using the Zoom app, and I'm going to read the number so you can log in for the Zoom. If anybody wants, write it down. And the Zoom app is either on your phone or on a computer website, but the number to log in is 292-712-810. I'll read that again. Again, this is for the Zoom messaging, Zoom meeting app, 292-712-810, 8 a.m. tomorrow morning if you want to hear about the updates to the codes for medical surveillance in Ontario.
Great.
Thank you.
Thanks a lot.
Thank you very much.
Any quick questions?
Janice. We're just bringing the mic. While the mic's coming over, I do want to acknowledge Leon's leadership in the Safer Work Ontario and in the Healthy Worker and Healthy Workplace initiative, but also over his whole career at the Ministry of Labour. He is retiring in a couple months, and we will miss you. But I think he deserves a round of applause for all his work. Okay, Janice, do you have a question?
Hi, I just want to clarify. I'm going to speak as one of the advocates of the occupational disease clusters now. So when I'm looking at one of the pillars you're saying is the risk-based inspections. And from one of your slides, it was the health and safety risk factors based on injury, illness, and fatality data, example from WSIB and Ministry's occupational database. So as one of the people who is dealing with the occupational disease clusters, my question is, when we are highlighting to the WSIB, we have this many people with, prostate cancers or lung cancers or ALS or whatever, and we're identifying some of these risk factors, and you're getting your data from the WSIB, who continues to deny those claims in large and part, are we missing things that you should be looking for in the workplaces in terms of risk factors for your blitzes and that?
So for the respiratory hazards, so most of the really informative data was from the OCRC policy paper from 2017 on what to focus on.
So not from WSIB data.
Right, so that's one small part of the puzzle, right? So I went through about 6 or 7 different bullets about what feeds into the process, and I say WSIB data is interesting, but you can use it as a small piece of the puzzle. For what we're doing right now, the specific carcinogens we focused on for respiratory exposures were based on stakeholder input and OCRC data.
Perfect, thanks.
Any other questions? I know it's 3:30, so
Almost on time.
yeah, no, it's we did. So yeah, thank you for your patience. Thanks so much for coming and staying for the day. Thanks to all our speakers. Maybe they all deserve a round of applause because I think, yeah, it's great. And
Say a big thanks to Belle. 5th year putting all this together. Thank you,
Kimberly. It takes a village, or the OHCOW village. We have many people helping move food around, and people back at the various clinics who helped with the name tags. Speaking of which, please return your name tag because we have to pay $1.39 a piece for them. But I have to keep buying the red ones because they go with our colors. So if you really want it, you can keep it as a souvenir. But otherwise, please return it. And we look forward to seeing you next year at our 6th annual October event. The videos will be posted online as well as the presentations, and we will be sending out a link for a survey because we need to measure our impact. So I look forward to feedback on what you liked about today and even what you didn't like about today, and also some suggestions for subjects related to October in the future, or also related to the OC Disease Action Plan, or if you want to reach out to any of the speakers, we can facilitate that too. So thank you very much, and safe travels home.